Hi guys, welcome back to the Kelvin TV. On this episode, I want us to talk about feeding tubes that you need to know, or feeding tubes that we use for unconscious patients, helpless patients, or patients who are finding it difficult to swallow. I know most of you, the common one that most of you know is the NG tube, but no, we have different kind of tubes that we use for feeding of unconscious patients, helpless patients, or patients who are finding it difficult to swallow. So in this episode, we are going to talk about a whole lot of tubes that we use for feeding. Stick and stay with me and turn on your post notifications so that anytime I drop video on this channel, you'll be the first to watch. Guys, let's get into the video. The first tube that we are going to talk about is the Nasogastric tube, which is known as the NG tube. When we talk of the NG tube is being used for patients who are finding it difficult to swallow, or patients who are unconscious and due to that cannot tolerate any food through the mouth, or cannot tolerate oral fluid or other things that will go through the mouth. This tube is inserted through the nose into the stomach. It is inserted through the nose into the stomach, and it is a short-term tube that's being used for some few days, or approximately for 6 weeks. So this is a short-term tube that we can use for the patient who is unconscious. The next one that we are going to talk about is the Orogastric tube. When we talk of the Orogastric tube, it's mostly known as the OG tube, and these tubes are being used for patients at the neonatal or intubated patients, case who are being intubated, and case at the neonatal unit with maybe some conditions when the kid or when the infant or the little one cannot breastfeed or cannot tolerate breastfeeding. That's when we pass the Orogastric tube, so that we can use that one to feed the neonate, feed them with some oral medications and other things. Then also, these tubes are being inserted through the mouth into the stomach. These tubes, known as the Orogastric, they are being inserted through the mouth into the stomach of a neonate. And the next one that we are also going to talk about is the nasoduodenal tube. When we talk of the nasoduodenal tube is being used for patients. It's being used for patients who are suffering from a severe or a high risk of aspiration. So when there is a high risk of aspiration or delayed gastric emptying, that's when we insert the nasoduodenal tube for the patient to help them. So mostly when the patient is suffering from, or they mostly give it to patients who has or suffering from gastroparalysis or reflux. Those are the people that we insert this to. And this is inserted. They are inserting this to it passes beyond the stomach into the intestines. So it passes beyond the stomach, then it moves to the intestines. So that's what's known, or that's what about the nasoduodenal tube. Then we have a gastrostomy tube. When we talk of the gastrostomy tube is being used for patients who are suffering from chronic neurological or severe dysphagia. So when the patient is suffering from a severe dysphagia or chronic neurological disorder, that's when we pass these tubes. And this tube is being inserted through the abdomen into the stomach. And it's also used for a long-term feeding of a patient who is unconscious or having this condition known as the chronic neurological disorder. Then the last one that we are going to talk about is also known as the jejunostomy. So when we talk of the jejunostomy tube, or the G tube, or the J tube, this tube is being used when the stomach cannot be used for feeding. So when the stomach cannot be used for feeding, we give these, or we pass these tube known as the jejunostomy tube into the patient. So mostly when the patient undergoes surgery, or when there is a severe reflux case and the patient cannot tolerate, or the stomach cannot be used for feeding, that's when we pass these tube known as the jejunostomy tube. And it is being inserted directly into the small intestines. So the jejunostomy tube is being inserted directly into the small intestines. Before we end this video, let's talk about nursing tips. The nursing tips for NG tube. The nursing tips for NG tube. The first one that you need to know is you need to first verify the placement of the tube. You need to verify the placement of the tube feeding. Then the next one is you need to clean the site regularly, then monitor for infections. So you need to clean the site of the tube regularly. So that's it. Then you need to also monitor for infection. Then the last one is you need to know the feeding type. You need to know the type of feeding that you are going to, whether the feeding is going to be this or that, or going to pass through the nose, going to what? Pass through the intestines, or you need to know all these things. Guys, thank you guys for watching. Keep on watching Kelvin TV, and please subscribe, turn on the post notifications so that anytime I upload video on this channel, you'll be the first to watch. I love you guys. Bye bye.